Good afternoon and happy Nurses Month. It is so great to see so many of you joining us virtually. One of our most popular sessions during nurse recognition celebrations has been what you're going to be seeing next, and that is the power of nurse-patient stories. This session has been so well received in prior years. And so I'm so delighted that we're having another session today and again next week. Excuse me. This session is actually facilitated by colleagues that you've met before as well. Dr. Annie Brewster, an MGH physician and executive director of Health Story Collaborative, and her colleague, Dr. Jonathan Adler of Health Story Collaborative. So I'll be handing it over to them to lead this session, and I hope that you enjoy it this year as much as you have in the past. Again, happy Nurses Month. Thanks so much.
Welcome, everybody. We're very happy to have you here. I am Annie Brewster. I'm an internist at Mass General. And today we're here to honor and celebrate two amazing storytellers, a nurse and a patient. I know from personal experience working alongside nurses that nurses are present with patients at the bedside and in the midst of care in a way that doctors aren't. Emotionally available, more moment to moment, and more connected, really. So I want to start this by just saying thank you to all of the amazing nurses at MGH. I know that the past few years have been especially challenging, and you've all been amazing. So I'm really happy that we can be here to honor the nurses today, and especially the storytellers. Before we get into the heart of the program, which is to hear the storytellers, I'll just briefly give you some background on how I came to this work. So as I said, I'm an internist at Mass General. I am also myself a patient living with MS since 2001. And through my experience as both a patient and a doctor, I have really learned that storytelling is the key to healing, or I've come to believe that, and also the key to sort of transformation of healthcare to make it more connected and more human in nature. It really came out of my experience of sitting on the patient side and learning what felt sort of broken, and also working as a clinician and seeing that there just isn't enough time and space sometimes to honor the stories of patients' lives. And I was lucky to come into contact with John Adler, and he'll tell you more about himself in a minute, and to learn about the research on the health benefits of storytelling. And all of this ultimately led me to found a nonprofit called Health Story Collaborative in 2013. And our work is dedicated to helping individuals who are facing health challenges, and that can be patients and providers and patients' loved ones, really learn how to integrate these challenging experiences into their life through storytelling, and then share stories in community for the sake of healing, both individual and collective healing. So really the patient and provider sharing side by side, I think, is an important way to highlight the humanity of both, and to help remember that we all want the best for one another, and we really all are striving for connection and meaning. So I'm going to turn it over to John so he can say a bit about himself, and then we'll get to the heart of the program. Thank you for being with us.
Thanks, Annie. And yes, thank you all for the work that you do, and for inviting us to join in the celebrations. It's really very meaningful to us. So I'm John Adler. I've worked really closely with Annie over the past decade to ground our programs in the science of narrative and well-being. So briefly, I'm an academic clinical psychologist, and my research really focuses on the ways in which the stories that we tell about our lives become our identity, and also how those stories relate to our psychological well-being. So Annie and I have been working to develop programs at Health Story Collaborative that really leverage the scientific literature to create healing spaces in the medical ecosystem, spaces for story creation and story sharing. So although you won't see much of it on display here today, we wanted to let you know that the work that we're doing here is all this work done in preparing today's event really is deeply grounded in the science of narrative. That may be a discussion for another time. So at Health Story Collaborative, we call events like these healing story sessions. The act of writing and sharing one's story is deeply healing for the storyteller, and making time to deeply engage with others' stories is healing for all of us. That's something that nurses often know intuitively. Receiving other people's stories is also a powerful source of healing. So while today's event features two storytellers, it's truly an event for all of us. Coming together around shared stories is the foundation of caring for each other.
Excellent. Thank you, John. So today we're lucky to hear from Lauren, who is a nurse, and from Jonathan. We have two Jonathans with us today, so we'll refer to Jonathan, who's the storyteller, as JG, if we get confused. I just want to start by saying thank you to them, because a lot of work has gone into this. They've really engaged deeply with their stories and have gone through drafts and rewrites and have really worked hard. And also it takes tremendous courage to stand up and share in this way. And it really is a gift to all of us to be able to hear from them. So thank you to them. So the way it's going to run, just so everyone knows, is we're going to hear first from Lauren, and then we're going to hear directly after that from Jonathan, and then we're going to move after that into the question and answer and discussion. So audience, your job is really simply to be present, to witness the stories. Please feel free as we go to leave comments in the chat. It's always really nice for the storytellers to hear from you. So you can do that there. And if you want to leave a question, you can also use the Q&A function on Zoom here to leave a question. And we'll explain more of that. When we get to the Q&A, you'll also have the opportunity to raise your hand if you want. So let me start by just introducing Lauren. So Lauren has been at MGH as a nurse for almost 12 years now. She started on a med-surg floor initially, where she was for 4.5 years, then worked in the Blake 12 ICU for a time, and then spent 2 years in the cancer center, which is where she met JG. And after that, and currently is in the PACU. So Lauren has so much to say, and we're really lucky to have you, Lauren, and I'm going to turn it over to you now.
Whack. The sound of a wooden floorboard hitting my father's back echoed across the Caribbean Sea in the middle of the night. What the heck, Lauren? I froze in disbelief. I was 11 years old and thought my father was being electrocuted. My instinctual knowledge of what the firefighters told us in elementary school sparked my actions. The voice of the fire captain echoed in my head. When someone is being electrocuted, they look frozen and you must break the current with a wooden object. My father had been below the wooden floorboards inspecting the wires of our catamaran in the moonlight without glasses. He was still. He wasn't moving. I reacted with what I thought I knew best, to save him. Although my instincts were wrong, my need and desire to step into action without hesitation came naturally to me. I was born to be a helper. When I was 16 years old, I got a frantic phone call from my mother to pick up my brother from football practice. Lauren, I'm at work. They think your brother dislocated his thumb. As I drove down the rugged dirt road to the field, instead of anxiety or worry, I felt a sense of pride. My mother, an emergency room nurse, trusted me to take care of my 11-year-old brother and bring him to the hospital. I calmly spoke to him and assured him he would be okay. I remember seeing his thumb. It was swollen and appeared misaligned and deformed. I could tell he was in pain from his tear-stained cheeks and quiet whimpers. I calmly drove him to the emergency room and proudly presented him at the triage desk. The nurse took over, and I remember thinking, this may be my calling. I remember later that evening when my brother was comfortably medicated and resting, my mother said, I think you'll make a great nurse someday. The seed had been planted. The following year, I began researching the best nursing schools in New England and ultimately chose to attend the University of Massachusetts, Dartmouth. Fast forward to my senior nursing mentorship at the Massachusetts General Hospital. It was a dream come true. MGH is one of the top hospitals in the country and maybe even the world. I was wide-eyed as I watched my preceptor and her nursing colleagues perform their daily duties. I wondered if I could be as good a nurse as they were someday. Now, 12 years later, I humbly remember many moments of patient care that have left an imprint on my heart. One in particular was when I was a new nurse. My patient was a 46-year-old woman with metastatic lung cancer. Despite prolonged chemotherapy and radiation, her cancer was aggressive and caused her significant pain. Her hospital admissions were becoming more frequent and longer in duration. Palliative care exhausted strategies to control her pain with little or no effect. The option presented to her was palliative sedation. The goal is to bring an end to irretractable pain, not hasten death. My patient was a candidate. I began my 7 a.m. shift unaware of what my day would entail. The night resource nurse informed me that I was being assigned to this patient for a reason. You know, you'll take extraordinary care of her and her family, she said. You'll be able to connect with them on an emotional level that they'll need today. Her words gave me a sense of pride and also a sense of duty to uphold my nursing practice. Throughout the day, I watched my patient say goodbye to the precious members of her inner circle. I felt such sorrow, but an immense sense of responsibility. I would have the privilege of aiding my patient to a peaceful death. It was time. She took a deep breath, looked at her husband and children with tear-filled eyes, and squeezed their hands. I asked if she was ready, and she nodded. I administered the drugs and began the drip at the prescribed dose. Eventually, she settled into a persistent sedative, unconscious state and had a peaceful death a few days later. Nursing school does not prepare you for the immense emotional and personal relationships you develop with patients and their families. It is the experience, growth, and compassion that runs deep into your core that does. Throughout my career, I have witnessed and experienced many painful emotional experiences. I have often found myself attempting to empathize, to understand what my patients are going through. In 2015, the roles reversed. At 27 years old, I was diagnosed with stage 3 metastatic melanoma. I remember seeing the spot on my arm, no bigger than a Q-tip. I'm an Italian-Irish girl who tanned easily and has too many freckles and moles to count. It wasn't unusual to see a new freckle show up, but something was different. It had a different pigment, almost purplish hue. Something was off. I saw my dermatologist a few months later and expected a biopsy. She endorsed it looked different, but assured me it was likely nothing. I left the office that late September day and didn't think anything of it. It was late afternoon at work, mid-October. I wasn't busy and figured, I wonder if my results ever came back in for that biopsy. I mindlessly typed in my information and scrolled down. Malignant melanoma. It was staring at me straight in the face, as if someone highlighted it with neon. Malignant melanoma. The words spun in my head. No, that's not real. I don't have cancer. I can't. I'm 27. Melanoma? The deadliest, most aggressive form of skin cancer. The #1 cancer killer of women aged 25 to 29, and I had it. The next few days and months were a blur. Phone calls, surgery, a scar that I was told would look like a shark bite, maybe 6 inches long, a sentinel lymph node biopsy. The cancer had spread to my lymph nodes. Another surgery, a full body PET scan, a brain MRI. Unfortunately, cancer doesn't wait for you to accept it. It's just there, sneering its ugly face. I will never forget the day I met with my oncology team. They recommended 12 months of interferon, an immunotherapy drug. It was right before Christmas, right after my second surgery. I felt numb as I listened to the oncologist list the side effects. I went home and cried the hardest I ever have in my entire life. I screamed, I wailed, I stomped, I sobbed for hours. I had already been through so much. How could I possibly muster the strength to do this? An entire year of treatment? I knew deep down I was going to do it, but thinking of that journey at 27 years old broke my heart. Then came the time that I arrived at the MGH Infusion Center, and I was placed in a bay of recliner chairs. Surrounding me were 3 older adults receiving IV therapy, one of them bald, another one with heavy bags under her eyes, the other silently vomiting into a bag. I started to cry. My nurse instantly knew this was not the spot for me. She moved me to a private room and put in a request to have a private room for every visit. She was the kindest, sweetest person, and I will forever be grateful to her. The painful experience of the year I was on treatment is hard to put into words, but I know living through it in turn has made me a better nurse. A few years later, I made the decision to transfer from my bedside job in the ICU to the cancer center. I wanted to give back to the unit that I healed in, to share the words, "I've been there," with someone struggling. It's a line of work I couldn't have been more grateful to have stepped into. The relationships and bonds I created with patients, especially the young adults, were truly serendipitous. I remember the day I saw Jonathan on my new patient list. He was 18 years old, autistic, and recently diagnosed with Ewing sarcoma. I panicked. I don't have any experience with autism. How can I best care for him? Can his parents even be with him, even though we have no visitors because of COVID? I frantically thought. I immediately called the child life specialist for advice on what to do next. The next day, I felt as prepared as I possibly could to take the best care of Jonathan. I remember walking into his room. He was shy and gripped his precious stuffed Cookie Monster close. I met his mother's eyes with as much compassion as I could. She was terrified. I recognized the look as I remembered my own mother when I was going through treatment. I knew how to best care for Jonathan, but I had to earn her trust too. You know, I said to them, I had cancer too. It was a vulnerable share, but it was the only way I knew how to give them both hope and perhaps a good reason to trust me as his nurse. What? You did? They both exclaimed. I proceeded to share my story of how I was once laying in the same spot he was. I didn't sugarcoat it or embellish. I was honest. I gently explained that it would be hard. There was going to be good days, bad days, and simply just okay days. I shared the most important piece of advice that helped me get through treatment. One day at a time. Jonathan was young. His oncology team chose to aggressively treat him in the hopes of giving him the longest, most fulfilling life possible. I knew his treatment regime was going to be no easy feat. The projected plan was to have several types of chemo along with radiation. Explaining the side effects and what to expect was always my least favorite part. It made me cringe and every empathetic cell in my body would quiver. However, just like my patient receiving palliative sedation, it was my honor and duty to care for him during a very dark, scary, and overwhelming time. Each week, I always looked forward to seeing Jonathan and his mother, Nancy. Jonathan almost always had a smile on, even if he didn't feel well. Nancy was always ready to cheer him on and remind him of his strength. It was a beautiful relationship to witness. Although autistic, Jonathan is highly functioning and loves his video games. Each visit, we would excitedly talk about his recent obsession in the hopes of taking his mind off where he was. As the weeks and months progressed, I saw the light in him begin to dim. I knew he was getting tired, frustrated, and angry. Again, a feeling I was all too familiar with. Treatment was taking a heavy toll on his mental health. I remember a day I came in and he wouldn't meet my eyes. He somberly responded to my typical inquiries of how have things been. It could be better, to be honest, he said as he mustered a small smile that faded quickly. I felt helpless. All I wanted to do was take away his suffering, help him feel better, help him see that this is temporary and there will soon be a light at the end of the tunnel. Jonathan, being the incredible person he is, works for the ARC, which is the largest national community-based organization advocating for and with people with intellectual and developmental disabilities, serving them and their families. Jonathan helps other autistic children develop skills and utilize tools to function better with autism. I began to inquire about what he will do when he finishes treatment. Jonathan, imagine all the people you will help when this is over. His mother and I encouraged him together. I could see the light flicker. I know, I always want to help people, he told us. I smiled. Hope had been restored, if only for a moment. A period of time passed when I didn't see Jonathan as he was completing radiation treatment in another area of the hospital. I kept tabs on his progress, and his mother continued to be his unwavering rock and biggest cheerleader. The day he returned for treatment, we excitedly shared the countdown for when he would be done. Just shy of his 19th birthday, after countless bags of medication, IV fluids, chemotherapy agents, and radiation therapy, he was done. We celebrated with a Cookie Monster themed party and rejoiced. Although I was so happy to see him finish, I knew this was only the end of one chapter. I gently did my best to prepare him and his mother for the next leg of the journey, the aftermath. The cease of appointments, treatment, and constant surveillance is freeing at first, but then comes the anxiety and panic looming. What if it comes back? What about my next set of scans? Once again, I was happy to be the guide as I coaxed both Jonathan and Nancy into taking things one day at a time. Upon Jonathan's treatment ending, it was also a time for transition for me. I made the challenging decision to leave the cancer center and return to my roots of surgical nursing. Although I found beautiful, meaningful, and irreplaceable relationships with my oncology patients, it was too hard for me. It broke my heart to recognize my own suffering as a nurse. I witnessed patients fight to their death despite doing everything we could. I felt the heaviest burden on my heart. I wanted to show up as present and compassionately as possible, and leaving the cancer center was the best decision for me to continue being the best nurse I could be. Months later, as I reflect sharing this story, I think of the beautiful experiences Jonathan has given me as a nurse. I learned how to navigate difficult conversations and infuse hope as best as I could. I was able to gain his trust and develop a strong rapport of compassion and understanding. He has also taught me a few valuable lessons that I will never forget. In times of challenge, it's okay to ask for help. In times of frustration, it's okay to get angry. In times of hopelessness, it's okay to lean on others. And in times of having cancer when you're 18, it's okay to buy only the best video games. Thank you so much.
Oh, thank you, Lauren, for that gorgeous, poignant story. We so appreciate your openness, your vulnerability, and your wisdom. So thank you. For all of you here, please feel free to put comments in the chat for Lauren. Being on Zoom instead of in person makes it easy for so many of you to join us, but it also puts this digital barrier between the storytellers and all of you. So it would mean a lot to hear from you. So please feel free to use the chat. And also please remember that we're going to have a Q&A session at the end. So feel free to put your questions for Lauren or for Annie and me into the Q&A function at any time during today's session, and we'll take them at the end. So thank you again, Lauren. Okay, so now we're going to hear from Jonathan Gardner, who you've already heard about from Lauren. As you've heard, Jonathan has navigated more than his fair share of challenges in his 19 years, but instead of letting that sink in, he's decided to use his experiences to advocate for others. Jonathan's mother, Nancy Gardner, is also here with us off camera, but I'm sure she'd be happy to take questions from you when we get to that part of the program later. But for now, let's welcome Jonathan Gardner.
Hello, give me a sec. Hello, my name is Jonathan Gardner. I am 19 years old. I live in East Bridgewater with my mom, dad, and brother Eric. I like video games, anime, wrestling, and advocating. My vision is to help other people in any way I can. I happen to have autism, and I am a cancer survivor. In 2021, I transitioned for adulthood by turning 18, dealt with COVID, and got cancer. Fighting cancer has been one of the hardest journeys of my life. I am so thankful I was given the freedom to choose how I went about my treatments. I did not have many choices when it came to having cancer, but at least I could control when and how I beat it. Before I had cancer, I remember on September 12th, 2020, I was doing a 5K walk for the Doug Flutie Foundation. Normally, we would go to Natick, but because of COVID, we did a virtual 5K. We chose to do it in Hanover at my dad's old school grounds. I was with my mom and dad. I was thinking about the music I was listening to as we walked. It was Mega Man X versus Zero, a song from a video game soundtrack. As I walked, I felt very motivated. I saw my dad's old school grounds, beautiful walkways, a bridge, and my mom carrying our good luck charm, a Cookie Monster. Cookie Monster has always been a sense of comfort for me. He brings me to a time in my life, when I was happy and safe. Fun fact, I happen to own over 50 Cookie Monsters. So helping others has always been so important to me. When I was 8 years old, I was physically and mentally abused by teachers in schools. My voice was not listened to, and neither was my IEP, which is my individual educational plan and a legal document. From then on, I was homeschooled. Homeschooling worked for me. It provided a safe environment that allowed me to learn from the point I was at. My mom never rushed me to learn faster. I just learned at my own pace. Part of my healing from my trauma included sharing my story to change the law in Massachusetts. My story was shared at the State House, and the law was changed for restraints and seclusions in schools. This law keeps other children safe so they will not be abused like I was. This change brought a very peaceful feeling. When I was 13 years old, my mom helped me to create a vision so that I could live my best life. My vision at the time was simple: to help others in any way I can. To this day, it is still my vision. The day I found out about my diagnosis, The day I found out about my diagnosis, I was trying to start a video game called Valkyria Chronicles. For some reason, I felt something was stopping me, and I shouldn't be playing. So I stopped. I then did a logical thing, being a boy with autism. I decided to go upstairs and check on my safe person, my mom. And I asked her a couple of questions. I had a feeling coming over me as I was going up the stairs: worry, dread, concern. Then I heard my mom crying. I listened in to my mom, who was in my dad's office. I thought the only logical thing to do was to open the door and ask what was going on. After a small amount of prodding, I was finally able to get the truth. My mom told me I had cancer. I thought it was a joke because it was near April Fool's Day. After processing that this was not a joke, I thought, how are we going to explain this to everyone I know? My mom told me I had Ewing sarcoma. From when I learned this is a very rare cancer, I went through a lot to get my diagnosis. In the beginning, we all thought maybe I had a Charlie horse in my leg or needed new sneakers because the pain in my leg would just not go away. When we went to many doctors, one even told my mom I may need a psychiatrist because they could not find anything wrong with me. Finally, I met a doctor who told me she did not know what was wrong, but she was going to find out. This doctor got me scheduled for an MRI. It took 3 MRIs to finally get the results. For the first 2, I could not stay still because I had a tumor on my spine. The MRI technicians kept saying it must be my autism, even though I kept telling them it was the pain. Finally, I was scheduled and sedated, and that is how we got the diagnosis. It took a little over 4 months. On April 19th, 2021, I began my chemotherapy treatment. I had no idea what to expect. In preparation, my dad came up with the idea to get me a new Cookie Monster for me to take to the hospital. My mom was able to talk to the hospital staff and got a real port to place inside my Cookie Monster so I could feel what the port would feel like inside my body. Knowing what the port was going to feel like and what it was going to do relieved a lot of anxiety for me. I was glad that they let my mom come into the infusion room with me. My mom and I were sitting in this little room that had a bathroom, a bed, and a chair. I sat right on the bed and my mom sat in the chair. Then a nurse came in. She had black hair that was all pulled back, hospital scrubs, and a mask on her face because of COVID. I could tell right away that she had a smile on her face because her cheeks seemed to be raised a little bit above her mask. She came right in and introduced herself to me and my mom. Her name was Lauren. She asked me to tell her about some things that I love. I told her all about my favorite video games and my work as a skills trainer. Before I got diagnosed with cancer, I was a skills trainer for the Greater Arc of Brockton. Through my job, I was able to provide friendship and mentorship to two young boys with autism. I taught them coping skills and took them out into the community for fun activities. She was very interested, and we talked back and forth for a while. Lauren gave my mom a lot of papers and information and a hug. I think at this point, my mom and I were both feeling a little more relaxed. Lauren then explained to me how the chemotherapy was going to be going into my port. She told my mom and me all about the drugs that were going to be used and told us at any time to ask questions. I remember that day that Lauren told me that she would always be there for me during my treatments and had handpicked the nurse who would switch out with her so that I felt comfortable with who was treating me. I honestly was very overwhelmed by all the kindness I was feeling. I felt like Lauren really wanted me to get well and was going to make sure I did. My treatments consisted of 14 cycles of chemotherapy. Once I was halfway through my treatment, it was time to start radiation, which lasted for 31 days. Doing chemotherapy and radiation at the same time was very challenging for me. I felt broken. I wanted to quit. I was feeling so worn down and just sick every day. Lauren would come in and give me my treatments daily. She began telling me more about her own personal journey with cancer. This helped me out so much to know I was not alone in my thoughts. She always asked me about things I loved and would ask what game I was playing during my days off. But I got to a point where I had no joy at all. I was crying and having a really hard time physically and emotionally. One day, Lauren came in and shared with me that she had nominated me for Caring for a Cure. She wrote to Caring for a Cure to see if I could have something to bring me joy. I was so overwhelmed with feelings that I cried happy tears. No one has ever done anything like this for me before. One of my favorite things, give me a sec, went a little bit too far. One of my favorite things about Lauren is that she took the time to get to know me as a person. We spent a lot of time sharing our stories together. I was pleasantly surprised when she told me she was an empath. When I was younger, I was diagnosed with having too much empathy, so it was nice to know another empath. Each cycle brought some very strange and rare reactions. For instance, Lauren would be in the infusion room just talking to me, and suddenly I would get a rash traveling all over my body. Then all of a sudden, it would just be gone and then come back just as quickly. It was nice that Lauren was always there to see these reactions because she made me feel safe and not crazy. When Lauren had to go see other patients, she would always say to me, "I'll be back." We both laughed. She always added some humor to my day. Once I came in after the weekend and Lauren had gotten me a Cookie Monster cap for my head since all my hair was gone from chemotherapy treatments, I would wear it for good luck. One of the reactions I ended up with was a constant feeling of nausea. My doctors had recommended I have a backpack of fluids to go home with for the nights. This was a regular looking black backpack with a mini chemo pump with a huge bag of fluids inside. It was connected to my port, so I would get fluids all night. Lauren had the great idea to decorate my backpack with a Cookie Monster sign and some tassels to make me feel special. The sign she added to the backpack read, "Keep calm and num num num." She added a personal note to it that read, "You are a rock star. Don't ever forget that. Love, Nurse Lauren." I still have that note she made on my prayer wall at home. Lauren was always looking for ways to make me feel better inside and out. When I was almost done with my chemotherapy treatments, Lauren told me she had to talk to me and my mom. She told us that she would be leaving infusion and moving to a different department. She wanted to make sure we were okay with that. Of course I was. I want Lauren to find joy in her job and life and continue to make a positive difference for others. I did something then that I have never done before for anyone else. I told her I would give her my cell number so we can remain connected. I normally do not do this because there are not many people I fully trust, but Lauren, I truly trust. And it was at this moment that I realized she was not just my nurse, but my friend. I knew that we would stay connected and she will always be in my life. Even though Lauren took a job in another department, she made sure to come back to infusion on important dates for me. For example, there was a drug called the Red Devil. You can only get this drug 6 times in your lifetime. Well, I was on my 6th time, and guess who showed up? Lauren did, and boy, was I happy to see her. It was just a nice feeling to have her there to complete this drug. On my very last day of chemotherapy, Lauren was there too. She helped celebrate with us. I was glad she got to meet my older brother, Eric, too. The best part is that now that I am in recovery, we are still connected and continue to share our journey. My recovery has been challenging. I felt like I had not a chance to enjoy things yet. I'm still having some side effects from my treatments and seem to be in and out of the hospital for a lot of answers. Because my cancer tumor, I will now have lifelong mobility issues. So I have to be going to PT and a lot to help me strengthen my core muscles. As long as I can find joy in every day, even if it's just a video game or watching anime, I'm ready to accept my new normal. Throughout the past year, advocating has become part of my life. My advocacy work and goals really give me a purpose. It has created a reason for everything I've gone through. I currently am sitting on a national committee called the Youth Steering Committee to help people with disabilities navigate their own healthcare. I have testified for supported decision-making. Supported decision-making is an alternative to guardianship that allows people with disabilities to make their own decisions by choosing supporters to help them make choices. I have also testified and am a co-teacher for Operation House Call. Operation House Call is a program that believes healthcare professionals can learn important communication strategies directly from the individuals with disabilities and their families, so that everyone gets the healthcare they deserve. I feel like I have found one of my callings. I am passionate about using my own experiences to make sure others get the healthcare they need. I am so thankful every day that I get to live and share my voice. Life is such a gift to me and should be for all of us. My plans for the future are to continue to live each day, be positive, and make others happy. I feel like things happen for a reason. I know Lauren and I were connected for a reason. I know that she has made a positive impact on my life during a very difficult time. She has become a true trusted friend to me. Thank you.
Thank you so much, Jonathan Gardner, JG, for sharing that amazing story. I, again, encourage people to put comments for Jonathan in the chat. And also, we're going to open it up in a minute for question and answers. So you can use the Q&A function along the bottom bar of your Zoom screen to put in a question or a comment that you want shared or something for discussion. So please do that, because that will make it really worthwhile for all of us to hear what other people are thinking. We really encourage the audience feedback. What we typically do when we get to the end like this of hearing both stories is give the storytellers a chance to respond to each other if they want to. I think I didn't say this, and I should have said it at the outset. They have not yet heard each other's stories or read each other's stories. So we worked with Jonathan and Lauren independently. And so this is the first time that they've really heard each other articulate these stories. And that can be, I think, a really interesting and moving experience. So no pressure at all for Lauren or Jonathan, but if either of you have anything that you would want to say to one another, please feel free to jump in now and do so.
I guess I'll go first. I'm wow. I'm just like wow about all of that, Lauren. To be honest, like honestly, me and my mom were actually kind of tearing up over here. I was shocked with everything, honestly.
I'll just say hi, Lauren. I love you so much, and I'm so grateful for you. And we're just so grateful for all the care that you gave to Jonathan and the friendship, because it was during a really hard time, and you just offered us both such peace during it, and sharing your personal story with us was so powerful to both of us to know, you know what, we can push through this, and it gave us both such hope during such a scary time. And you know, we just love you so much, and we're so glad that you are part of our lives now. And I feel like Jonathan said, things are meant to happen for a reason, and you know, we're always going to be family now. So we love you.
I love you guys too. In response to yours, I mean, I'm glad my video was off because I was crying a lot. I think one of the most beautiful parts about being a nurse and, you know, being in healthcare, to be able to take care of people is, you know, you try to do all the things to help someone. And, you know, I forgot that I decorated your backpack with all that crazy stuff. When you mentioned it, I remembered, but it's like, you know, to me, I was like, okay, what can I do to like really, you know, yeah, I would always be silly when I left the room and make funny jokes to Jonathan and Nancy. And, you know, that was what I wanted to do, was, you know, create that sense of hope, that sense of, you know, laughing during a dark time. And so to hear that that actually happened and that it actually worked makes me feel validated for the work that I do, because being a nurse has been really hard over the past several years. And then just in general over my career, it's not an easy career to have. And so to be able to get that, you know, validation back from the both of you from that story, Jonathan, and you read it so perfectly. I mean, like I said,
Same to you.
Oh, thank you. Thank you.
Same to I was thinking to myself, man, I'm supposed to be speaking like with the job and all that stuff. You're doing more. You're doing much better than I have ever done in my life.
We're both rock stars, buddy.
Wonderful.
Always,
Yeah.
always.
And we just always knew, you know, as much as we never wanted to come, we'd have weekends off usually, and then we'd be like the Sunday night dread would come. And
Where we have to wake up like 5 in the morning and
But
just drive.
it was like, but on a good note, we always would try to find that little piece that would make us happy. Who are we going to go see? We're going to go see Lauren and Molly and Marta and David and Judy and the whole everybody, you know. And it was just like, we love and trust all of you at MGH, and
Yeah, we literally see you guys as family, honestly.
it just it's just amazing. No, I'm okay. I'm okay.
Oh, it's so wonderful to see you get to enjoy each other's stories in this way. If anyone has questions, feel free to put them into the Q&A. But we like to ask a little bit, if you could share, both Lauren and Jonathan, share a little bit about what it was like for you to work on your stories in this way, right? We're always telling stories as part of our just being humans, but this is a different kind of thing to sit down and really work on, not just writing it, but then revising it and practicing it. So it would be great to hear a little bit from each of you about how that process was for you.
It's emotional. I think when you start to reflect and realize, you know, at least I'm speaking for me personally, you know, having been a nurse and then getting cancer myself, and all of a sudden being on the other side, and then, you know, going into the fire, if you will, that I went back to the cancer center, you know, that was a really big decision for me to transfer over there, and then to have the experiences that I did and witness that, you know, it was really hard for me to leave, because it was a lot for me emotionally and as a human, not just as a nurse and as a patient. And so I was protecting myself to move on and leave. But I also, in that reflection of telling my story, you know, it allowed me to have some validation and, you know, that I did make a difference when I was there for the 2 years that I was in the cancer center. And, you know, and I still make a difference with my patients. It's just in a different way now. You know, I still have oncology patients in the PACU and I can impact them that way. But just the reflection of being able to share such a beautiful connection that you make with patients, you know, as a healthcare worker, as a nurse, and to be able to share it in a space that is so understanding and so appreciative is such a beautiful thing. So it was a really nice experience, and I'm glad I got to be a part of it.
What about for you, Jonathan? What was it like to work on your story and practice telling your story?
For me, so I have this book that me and my mom has filled with well, I guess experiences, as you can kind of see here in very poor quality, but we actually went well, at least I went through it, and honestly, that was like one of the first times that I actually really dived deep into the book. I remember I think I was like lying down and we were just talking about what to do with all that stuff. I just actually signed into an anime streaming service that I was beginning to watch, and my mom talked to me about doing some stuff. So I decided, all right, I have this book. I'm gonna look through it. Just save me from trying to remember. So I decided to look through it, and like everything started to finally like flood back to me, like the backpack, for example. The last day that Lauren worked as my nurse in infusion, and like the first day as well, like things that I forgot about slowly starting to come back. And like from there, I was able to get the things I needed for this to be as powerful as it really was, and as true as it could ever be, honestly, for me.
And I can add to it. I know when we were working on it, because I helped Jonathan work on it, it was just so powerful, because, you know, we tried to go through, when he's talking about his book, I tried to almost photojournal his whole experience, the good and the bad, and it's amazing what we forgot, especially, I hate to say the bad, because I think we were just pushing through, that it was very emotional for me. The first time Jonathan practiced his story with me, I don't know if I was crying more than I am now, but it's just very emotional, because you're like, wow, like, look at what he accomplished and what he did. And with the support, I tell people this all the time, the support that he received at MGH was beyond anything I've ever experienced in my lifetime before. And the thing is, that support is constant, whether it's in recovery that he needs support, they're there, everyone's there. Lauren's helped with certain things. I know they keep connected, and, you know, is this normal for recovery? Is that normal? It's been an amazing experience that has changed our lives forever. And this story just makes it more real too, even though we lived it. It was just so fast paced when we lived it. It was, I don't know, I don't have the words to explain it. It was just very different. And I'm just so proud of him, and so proud of Lauren, and so proud of everybody that is involved in helping patients live their best lives. So thank you.
Thank you, Nancy. That's beautiful. So again, just a reminder to all that you can also use the raise hand function if you want to say something. You won't be on camera, but we will hear your voice. So feel free to do that, a comment or a question. I have a question for Lauren, though. And again, I always say people can answer or not answer, but my question is, I'm fascinated as a provider myself who has an illness, who has very rarely chosen to share that with patients. And at least for doctors in my training, that was sort of taboo. We were sort of encouraged never to do that. And I feel there's boundaries are of course important, but I think there are moments where that sharing is so valuable and is the most healing thing you can do. And that we allow ourselves to be human in those moments, and that can be worth a lot. But what is that thought process like for you around sharing your own stories and when to do it and when it feels right or not right?
Yeah, I think, at least, I speak probably most about it with my young adult population of patients, because I know what that felt like, being 27 when I was diagnosed. I was working in the ICU at the time. I understood how, it was like a rug getting ripped from underneath me. And so then there's not a guidebook that you can go out and say, okay, I'm a young adult who maybe there is, I don't know, but I didn't find it. And, being able to relate to your caregiver in knowing, like, it gives them a sense of hope, I think. And also just that empathy. One of the biggest characteristics of a nurse is being able to be empathetic towards their patients. And, for me, it was like, I got that extra dose of empathy to be able to share. And I think I very much, it's a decision that I make when I feel that a patient is in need of some extra empathy, and saying, I don't tell everybody, but it's something that I'm open enough about, that I think when they do hear, there's always the same reaction. It's, you did like that. You get it, like, because I was on the other side. I've been poked 100 times for IVs. Like, I get it. And so to have them be able to look at me and know that, like, I'm the other side, I'm the one who's going to be taking care of them, can be, very powerful. And but yeah, I don't share it with everybody, but I'm very open about it. I know my coworkers know, like, when they want to ask me, I wear compression sleeves at work. And so people are always like, what is that? Is that a tattoo? And then I explain, no, it's a compression sleeve because I have lymphedema. And then, there's a mix of reactions that people have when, they find out. But I would say most of the time, my patients are always, I find that it's a very enriching experience to be able to connect with them. And because I'm a human too. They're a human. And that's what we all want to feel like. And I think that's, came through in Jonathan's story, is that I tried very hard to talk about the things that he likes, because maybe, yeah, he wants to hear a little bit about what his cancer treatment and the drugs I was going to be giving him, but that's okay. I'll give him that information. But I also want him to know that he's a human. He's not just my number 3 bay patient. He's my, we develop these relationships, and it's important to honor that.
Thank you, Lauren. That's beautiful. I also want to say I loved when you shared the lessons that you learned from Jonathan. And just, I think that we always can learn so much from our patients. So thank you, Jonathan.
Yeah, I wanted to pick up and take that same question in a slightly broader way, which is to think from both of your perspectives as a nurse and as a patient about the ways in which the systems and the structures of the medical system do and do not make room for our stories. I mean, I was really struck, Lauren, by you saying there's no guidebook for this. I think you're right. And so I'm curious how both of you think about the role of personal storytelling in your experiences as a nurse, as a patient.
I guess for me, when it comes to storytelling, I guess it's a chance to give someone an idea of what to expect going into it. Like, for example, when I started all this, going into like doctor's appointments and all that stuff, I just basically expected, let me think, what I say I was gonna expect. I was expecting just, here's the treatment and all that stuff, and without any of the fluff. But instead I got, well, people that I consider now family, stuff like that. But that could also be a different story for someone else. But when it comes to like the medical way, probably, I'm just going to be straight up honest. I have no idea where I'm going with this.
That's totally fine. I think as a patient, often your job is to tell a certain piece of your story, right? Like,
Yeah.
A lot of the diagnostic process starts with you, with your story, but not always the whole story. Lauren, what about you from your perspective?
I guess just to get a clarification on your question, do you mean like implying that like patients would know like about their healthcare provider? Like,
Not necessarily your personal story, but I'm just curious about how, again, like the systems and the structures, the pressures on the profession either make room for or get in the way
yes, yes.
of really getting to know each other as people, really sharing your stories, whether you're sharing your own personal story or just receiving the story from your patients.
Yeah, I think, one thing that comes to mind is when I used to work in the ICU, and a lot of my patients weren't always awake. They were, in a induced coma, or they weren't really able to tell me much about them. And we have these posters that say, get to know me. And there are these huge posters, and usually the family fills them out and they get put in the rooms. And we all as nurses just adore them because it's a way to get to know, even if it's like, their favorite color is blue. Okay. Like it, or they really love The Sopranos. Like, it's that extra, connection with someone. Again, back to that human piece where, we're not just, a medical surgical, patient that we're taking care of. It's they have a life outside of these walls of MGH. And so I adore that. I love knowing about my patient, what they like to do, where they're from. And so I do know there's some, some physicians or services that will, in their notes, will list things like social, so we'll say, oh, worked as a nurse, or, has 5 kids. Like, I always really enjoy that. And so I'm sure there's ways that we could begin to implement that more into our practice, because I know I personally love that. And I'm sure many nurses would agree.
Thank you, Lauren. That's great. Jonathan, I saw, first of all, I was thinking when you were talking about storytelling and how you spoke in your story about your love of helping others, I think that's something else that struck me about sharing your story. I think it really is a way of helping others. And I think you do so much. And I just saw a comment in the chat that said, has Jonathan thought about becoming a nurse? Because he would be so amazing. Which I think is
I was actually just about to answer that, actually, but I'll just answer it here.
perfect.
The thought has crossed my mind before, maybe once, but honestly, it's not the path I want to take, for at least right now. Personally, I don't know how I would be able to handle seeing my patients die and everything like that. So with how much I know all that stuff, I would rather work in what I'm currently doing right now with supportive decision making and Operation House Call, helping in other ways that I can prevent either whatever happened to me beforehand, or help someone go through cancer or another medical issue with Operation House Call. At least give the doctors the tips to use for that. That's my thing, at least.
That's excellent. I think that sort of brings me to my last question, which either of you could answer, but it's about self-care and sort of how, and Lauren, I was thinking about your decision to leave the cancer center, which was hard, but it was also a type of self-care. Like, we can delve into these things deeply, but we also then sometimes need to step back. And so resonates what you just said, Jonathan, about knowing that it would be hard for you to be a nurse. But I'd love to just hear from either of you on sort of the self-care journey, or ways you think of taking care of yourselves when you're in the midst of struggles like this.
I guess I can answer this, actually. For me, it's like I said beforehand, it's about finding that joy in any way possible. Like, for example, even if it's just playing a video game or watching some anime, if you can find that joy, you can at least have that mental forward to it a little bit. But that's not always going to happen. Sometimes it's going to be too overwhelming. So you're going to need those days that, well, you break. I'll admit there's been some times that I have broken myself. They were far in between, actually. I'm not even saying that as being cocky about it, but yeah. But honestly, it really depends on how you handle it. It depends on the person, it depends on how you think, because some people could be ready and willing to take up the challenge is super strong and all that stuff. And some people need to rely on people. Like for me, my mom, I relied on her so much during my cancer treatment. Like honestly, like Lauren said about her being my rock, is the truest statement to anything you can even imagine for this family. Like I remember, this is actually something I probably could have put in after the thing I was speaking about. I remember when, after I got some stuff down, telling everyone, I sat my brother down and told him this, so that way I wouldn't have to worry about this. Just in case there's anything, God forbid, happen, I told him. Normally, I'm usually the rock kind of the family and all that stuff. I'm one of the toughest. I'm the kind of glue and everything like that. I told him that if something was to happen, God forbid, that I want him to take up that responsibility. And we cried over that for a while.
That's
And-
amazing. That's amazing, Jonathan.
Yeah.
You have so much wisdom, and I think, we all need to lean on other people sometimes. So I think I appreciate that reminder for all of us. We have to wind it down now. Unfortunately, we're out of time, but really, I just want to thank you, Lauren, and thank you, Nancy and Jonathan, so much for engaging with this process and sharing your stories. And thank you for the audience for coming to witness this. And thank you to Debbie Burke and Marianne DiDamasi for organizing us and giving us this time and space. Have a great afternoon, everyone.
Hi, thank you.
Thank you.